Hello, everybody, and welcome to the Bright Founders Talk at Temi. Temi is an international software development company that designs, builds, and delivers software for sustainable businesses and promising startups. My name is Matthew, and today I am joined by Mr. Patrick Anquetil, who's the CEO at Portal Instruments. Patrick, did I get your surname right this time?
Perfect. What an amazing pronunciation. Yes, it's a tough one.
Fantastic. Thank you. How are you doing, Patrick? Can you tell us a little bit about yourself and what it is you do as an introduction?
Sure, absolutely. So I'm Patrick Anquetil. I'm from France originally. And for about 20 years ago, I've been in the United States in Boston. I came to MIT to do a PhD and absolutely love the can-do attitude, the US culture, and also Boston as a town. And I kind of stuck around and also became American actually at the same time and started a few companies along the way. So pleasure to be here, and thank you really for inviting us.
That is terrific. Thank you, Patrick. There's a couple things I'd like to talk to you about regarding Portal Instruments, but I'd like for us to build up to that. If you could you perhaps tell us about where your journey began? Is this something, did you know when you were young that you wanted to work in the medical field when you were coming through school? Was this a dream of yours? Did you fall into it? Can you tell us how this started?
That's a great question. It's actually, I always believed as a kid that entrepreneurship and leading or starting companies was something you actually read in a newspaper. And I never thought it could be me. In France, I think we had always this we always put people high up on pedestals and so on. And also there weren't really any role models actually either. I didn't know of anyone who maybe was 5 to 10 years older than me who had started a company, and as such I could use as a role model. That truly changed when I came to the US. Even when I went to, I did my studies in Switzerland. I got to kind of tell you all about this actually as well. But even there, starting a company was almost an academic experiment. And I came to the States, to Boston in the early 2000s, when it was like the roaring 2000 with companies getting started left and right. MIT especially was a bedrock actually of entrepreneurship. Professors and students starting companies. There was a company called Akamai. Maybe not too many people actually know about it, but Akamai was kind of one of the poster child companies started by a mathematician. Basically allowed you to redirect traffic across the globe and kind of do load balancing. It's a pretty cool algorithm that does that. That company went public, I think, a few days after I joined. And I think the first day went up, 400% or something insane like that. So it was different times. And I think that sort of can-do attitude, as I mentioned, it really stuck with me, and I just couldn't leave, and I just stayed.
That's very, very cool. I like that. So you got into Boston and there was this momentum going on. And then where did you go from there? Now, you've got all of this going on. You want to start something. You've got some ideas. What did you do?
So there was it was a gradual progression. I was certainly fascinated by it, but I didn't kind of put it into action actually right away. So ironically, my first job actually after my PhD was in investment banking. I became a stock analyst for companies or covering companies that developed technologies that I was very, very familiar with. And so at the time, in the kind of mid-2000s, nanotechnology was kind of the buzz on Wall Street, a lot of investment dollars basically flowing into it. Investors needed kind of scientists like me, engineers like me, to really explain to them what's real, what's not real, what's hype, what's really possible. And so it made actually for an amazing sort of conversion from the academic world, because again, if you do a PhD, you're kind of on the academic track, even though you don't have to become a professor necessarily. And so kind of converting myself to business, and I really enjoyed that. And in fact, right at the same time, made the decision to actually go to business school, bite the bullet, invest in a proper business education. Went to Harvard Business School, and then after that is really when I felt I was equipped to start companies, and I've done 3 actually ever since. With Portal being probably the longest one that I've run.
That's fantastic. So tell us about the beginning of that now. So you've started 3 companies. You must have learned a couple things along the way that they didn't teach you in the books when it came to building bringing people on some of the challenges you might have gone through. Can you tell us some of that?
Yeah, of course. Yeah, I think first of all, the thing that probably you may hear from time to time is that it's actually much harder than you think. The idea part is actually the easy part, and I think, as Einstein said, 1% inspiration, 99% perspiration. It's really true. And I think the hardest part is that you, particularly if you're the leader of the company, you really have to manage your own psyche. You need to make sure that the highs don't kind of get you off track, and conversely that the lows don't get you terribly depressed, and so that you're gonna just continue on and so on. So I think that part is something that even today, having done it now for 15 plus years, it's still hard because the lows are just not fun. But the highs are good too, so you can balance. It maybe balances out actually, and so on. So I think that's the first part. The other part I think that's interesting. It's easy to fall in love with technology, in particular for technologists like me, and as such, really understanding the market is really the number one thing. And in particular, for technical application, you oftentimes have technologies looking for a problem versus the other way. And I've actually lived through kind of both combinations, being right on the market but not finding the right technology, and then having a good technology but having difficulty actually finding the market for that as well. And so when I review business plans, actually what's the most interesting is that the basic business equation, which is you have a product, you're going to sell it for X amount of money, it's going to cost you a certain amount, let's say Y, and X minus Y is your profit, and hopefully it's positive. That oftentimes, believe it or not, actually gets forgotten. And so the tech oftentimes is not necessarily the challenge. It's really what's the business model, what's the market, who do you sell to, what's really what you solve. I think these are the hard questions. And invariably, for the 3 companies I've been involved with, it took us years to figure it out. Like a couple of years, I think, on average, to figure it out. Because you sort of probe the market along the way, and if you're not on the market, you don't know. So it's kind of a bit of a chicken and egg. You have to prime the pump, you have to be in the market, and then you kind of start to understand, oh yeah, maybe you just got it wrong.
Looking at something like that now, getting into the market, finding this experience, you say it often took you years to figure out who these people were. You had to keep yourself going through those times.
Yes.
You had to have funding, you had to have resources. I'm sure you had responsibilities to people around you. It must have been pretty nerve-wracking at times.
It was certainly a lot of ups and downs. I think at the same time, I would say the hack here, if you can, it's hard, but a good night's sleep is the best antidote, I think, to that. At the end of the day, there's only so much you can do in one day, and maybe just to say, look, today was a bad day. Let's just just cross it out. Relax a little bit and take a bath or something, or shower or something like that, and then just take a good night's rest. And it's amazing how just the process of sleeping is almost magical, and how your brain sort of reprocesses information. And amazingly, the next day, it's happened over and over again. You either find a solution, or you see things in a different light. Maybe they're not as bad as you saw them the other day. And so on. So I think that to me has always been a great counsel. So when in doubt, go to bed early, and then just the new day, will certainly bring new counsel to your situation.
Now let's talk a little bit about Portal Instruments. There's a fantastic introduction on LinkedIn, but I'd like you to tell us, how did this start? Is this something that was built up through the last 2 companies? Was it a fresh idea? How did this come to you? And it looks incredible. The idea of it is fantastic. How did it come about?
Yeah, so Portal Instruments, actually, I'm not the inventor of the technology. The background is that my PhD advisor kind of called me back. I was doing another company. The company called SynapDX was doing developing a diagnostics for autism. And we were just starting the clinical study for that diagnostic test, and it would have taken, maybe like a couple of years for the results to read out. So there was really no need actually for me to continue there, or there was really like limited things to do, because we just were waiting for the results of the study. And so the timing was right. And so he had a technology at MIT that had been in development for about 8 years, that had backing from a pharmaceutical company actually, which incidentally happened to be French, so Sanofi. And the project had been very successful in his lab, and as such, he wanted to spin it off. And kind of the right place, right time situation happened. The tech was ready. I kind of was, starting to, be antsy. And then on top of it, Sanofi was actually willing to fund the company. And so that's how it started. And I thought it was an amazing proposition. And in my mind, having gone through the process now a couple of times, I thought, hey, this is going to be super cool, super easy. I'm going to raise $20 million and it's going to take me 2 months and I'm going to change the world. That's really what I believed.
Wow.
In reality, it took a year and a half to raise the money and I only got half. And Sanofi only put a third of that half. So to tell you, there's nothing's given. and it's never as easy as you think. But in the end, we were able to fund it and get started. And really with Portal, the idea is, could we look at a medical technology that we're all familiar with, which is the needle and syringe, which is actually an interesting device. It's super effective. I mean, it really delivers the medicine. It works pretty much all the time, but it's dangerous, right? If you prick yourself and the prior person had some form of disease, well, you might actually get it. It could be Hep C, HIV, really some nasty stuff can be transmitted through syringes. Or the other issue is that when people hate needles. So we felt there was a true possibility to actually impact the world. Pretty much, I mean, anyone on this planet has probably gotten an injection in their lives, even in a developing world actually as well. And so it's probably the most universal medical device technology. It hasn't really changed in the past 150 years. Now it's disposable, it's plastic, and then so on. But it's still the same principle. And so this was the premise. Could we really change that? And so then we had to figure out, well, how do we do this actually on the market side, and how can we create a business out of that?
I know a bit about the fear of needles. Not myself, but I've been in situations where people have been scared of needles, and to be able to alleviate that is something incredible. How's things going there? What are you guys like? If we look at where the business is at the moment, how are things looking? Positive for the future? Are you on an upward trend? Are things moving in the right direction?
Yeah, so what's very interesting is that let's talk a little bit about the business side of things. I think market-wise, I think it's unequivocal that people hate needles. If we went outside, you and I, and walked on the street and we asked any stranger walking towards us, do you like needles? I think we'll get a close to 100%. No, hell no. Get me out of here. We ran a few surveys during COVID and really tried to understand how people perceived injections. And we did the same thing for the flu vaccination as well. It's interesting. Out of the typical, 30% unvaccinated at the time, half of them would have considered it and done it if there was a needle-free option. So it's quite astounding how large those numbers basically suddenly get. So that's the positive. The challenge, though, is how do you make money, actually? Because a needle and syringe, even though it's unsafe and people hate it, it's still amazingly effective in terms of its cost, right? I mean, it's maybe 10 cents an injection or something like that. It's ubiquitous. It's kind of really entrenched. I mean, everyone knows how to use it, or certainly the medical professionals know how to use it. So how do you create a business out of that when what you're competing against is a commodity? And so we had to think hard. And what we realized is that, well, if what we inject is very valuable and we can enhance the experience, and maybe we can actually even keep the patients longer on the therapy because now they sort of might be perhaps more inclined to actually perform the injection, then actually that value that's transferred, we can capture some of that back. And so that was the key insight. And the second insight was to realize, okay, well, there's a lot of tech in the device. I've got actually one here. You can kind of see what it looks like. There's a lot of tech in here. It's actually really insane. And so it only is worthwhile if the device can be used multiple times. And so very quickly, we zeroed in on a class of therapies, which are, first of all, for chronic use or chronic diseases, and then where the drug itself was of high value. So think about those biologics or antibodies, therapeutic proteins, peptides, and so on. What everything that biotech basically has developed over the past 25, 30 years, those are the high-value molecules that, in fact, can be used to treat a lot of chronic diseases. So that kind of became the sweet spot. And then the third question we had to ask is the following, which is, well, who's got the money, actually? It's not the patient. I mean, patients never have money. The docs, it's complicated because it goes through reimbursements and so on. But we realized, on the other hand, the pharma companies had a lot of money. And in particular, if they were competing in a given market with drugs that were quite similar, the device itself could actually offer some form of differentiation. And we could perhaps conceive of a business model that's more akin to a license, where they get an exclusive license to use our device with their drug, and everyone else for that particular therapy or that particular target doesn't get to use it. That's kind of how we basically derived the business model. So it's a traditional so-called biotech license. We get basically an upfront payment for exclusivity, and then we set up a development program with milestone payments and so on. So that's kind of how we kind of solve this. How do we get paid for it, so to say.
You found a couple solutions, and what has the uptake been like? Has the response generally quite positive?
So it is extremely positive on the patient side, and we get emails all the time from patients. People on chronic use drugs, so people suffering from not only diabetes but multiple sclerosis, hemophilia, Crohn's colitis, rheumatoid arthritis. I mean, a lot of diseases that are of chronic use, where you have to literally inject yourself with those drugs. There is no other way. The great thing about biologics is that they mimic kind of nature in some way. The bad thing about them is that you cannot make a pill out of them. If you make a pill, your stomach will basically destroy the drug. And so you have to inject it. There is no other way. I mean, maybe at some point people will figure out how to make pills, but it's still, far, far away to get the right efficacy of the drug and get the right effect that you want. And so pharma companies are kind of stuck, I mean, pun unintended, I suppose, where they need a device. At the very least, they need a needle and syringe to perform the injections. And then because patients hate needles, they actually have devices called auto-injectors, where the patient is actually augmented with a device that has a spring that does all the pushing. So if you're familiar with EpiPens, in case of an emergency, kind of,
right.
use an EpiPen. It's the same technology, basically, that people have to use now. Maybe once a week, they have to inject themselves with that. And so we come in and replace that. So what are the challenges, which was your question? Well, first of all, we have to displace those existing kind of relationships and kind of convince them that we have the better mousetrap. And the second challenge is that pharma is a very conservative industry, right? And so their modus operandi is to take as little risk as possible, because on one hand, if they make mistakes, the patients can die, and so that's of course something that you don't want to do. And also conversely, if there are quality issues with the drug, then it's revenues that they don't get, and so they have to halt basically production, figure it out, and then go back. So that's been the challenge. It's a great business model. We definitely get good attention from pharma, but the time scale at which pharma moves are very, very slow, which is of course very well known as well. And it's a bit of a mismatch between a startup that's moving very fast and wants to get to revenue versus a conservative industry where time is measured in decades, not in years.
Yes. Absolutely.
So that's
Oh, nice. So tell me something. That was very, very enlightening. Thank you for that. Tell us a little bit, if you don't mind, about your team. Tell us about some of the people that you work with. You've mentioned some of the risks involved in this, as you said.
Yes.
Patients can die. There's a lot of money on the table. There's a lot of high stakes. So you must have a very strong team, some pillars that you can lean on for support and guidance.
We have an amazing team that's very diverse, in particular in terms of their competencies. So we have a mix of people who've been in pharma, who've know how to manufacture things actually as well, so who understand the medical device side of things too. We've got folks who have experience developing products in the medical device industry. We follow basically, all the ISO and FDA guidelines in terms of the quality system to make sure, again, that what we do is documented, that is performed to the highest level. When you go to our office, if you ever come visit, you'll see the quality sort of policy is on every ward in every room. And so we have basically this kind of, I would say, this very experienced team to set that up. So that's on one hand. In addition to that, we also have the young multidisciplinary go-getters that are extremely talented and always amaze me in terms of their level of contribution and also their level of competencies actually as well. And so it's an interesting mix. Where we have a bit of a gap is at the in between. We're missing a few kind of in between. So if you're very young and you're someone who's a self-starter, it's an amazing environment because literally we say, hey, just go get it, just do it. No one's going to be there micromanaging. And then of course, if you need more guidance, that might be a bit more challenging. And so it's not uncommon for startups that we kind of have the both ends kind of well covered with the middle a little bit light. And certainly that's kind of our situation there too. But yeah, the people really make the company. And what delights me most is to see, in particular for young team members, to see their trajectory, how they grow, and how we're able to kind of make them better, so to say, and really contribute to their careers as well.
Patrick, I'm not going to keep you too much longer. I've got one more question for you. If you could look back and give your younger self one word of advice before embarking on this journey, what would you say?
I think the mantra that I live by is just do it. I think it'd be that. I think if I realized it was so simple, quote unquote, of course. I've done it 3 times now. I would actually started much earlier. I think I'm way overeducated. Bachelor's, master's, PhD, and an MBA on top of that. So it's but it was my journey. So there was my path. But I think my younger self didn't know that. So it would have been good to know. And I'm always amazed when I see on the internet the young generation and their access to information that actually truly we didn't have actually at the time. I mean, I always tell the story. So grew up in Paris. When we wanted to have a data point, meaning like, okay, you were doing a research, you wanted to know, I don't know, like what was Berlin like in between wars, World War I and World War II? Well, you had to go to the library. Well, there wasn't one that was very close by. So you had to go to the main one. Then actually everyone was doing this too. So you had to stand in line. It's a true story. You had to stand in line for maybe like half an hour to an hour just to get in. Then you had to find the book. Then you had to find the right place, copy it, go back home.
That's right.
And then write your essay. Now it's just a millisecond and you get it on a click of a button. I mean, that to me is just astounding. And what delights me most is how the young generation is able to completely leverage that and beyond. So that to me is really amazing. And so that's why I'm generally very positive about progress and I think what's going on these days.
That's terrific. That's terrific. Patrick, thank you so much for your time. It's been an absolute pleasure speaking with you today. A lot of interesting things going on there. And from our side, we'll definitely be keeping our eye on you and watching out for future developments.
Thank you, Matt. Pleasure to be here and thanks for all your great questions.
Thanks, my friend.